Hello everyone and welcome to Struggling with PCOS. My name is Alyssa Bowers and I hope to provide insight on PCOS. In this PowerPoint, the following topics will be addressed. This PowerPoint will highlight the condition known as polycystic ovarian syndrome, or PCOS. Worldwide, PCOS affects around 10 million women. During the presentation, information and personal accounts will be provided through two interviewees' perspectives. The First Lady, Tanya Chambers, has had PCOS for 20 years and provides her personalized story. The Second Lady is Michelle Munch. Michelle is a certified registered nurse practitioner at the Fertility Center who has seen firsthand the effects that this condition has on women and their chance to conceive a child. The acronym PCOS stands for Polycystic Ovarian Syndrome. According to Michelle Munch, certified registered nurse practitioner of the Fertility Center, PCOS is above all a disorder of androgen biosynthesis, utilization, and/or metabolism. Put simply, this condition is a hormone imbalance that affects the balance of male and female hormones in women. PCOS is considered both a reproductive and an endocrine disorder. This condition affects specific hormones, testosterone, androgen, estrogen, and progesterone, which helps the reproductive system operate normally. PCOS also affects insulin levels in women, so it is also classified as an endocrine disorder. This condition affects women of all ages, but it is more common in women during their reproductive years, ages 20 to 30. In some women, PCOS is diagnosed at a young age around their first menstrual cycle. According to Tanya Chambers, PCOS patient, I was diagnosed with this condition at the age of 14. PCOS has a familial tendency, so chances are another female relative has it. According to Michelle Munch, certified registered nurse practitioner of the Fertility Center, a history of scanty menstruation, abnormal hair growth, and obesity, together with enlarged polycystic ovaries, are some of the symptoms of PCOS. Other symptoms of this condition include baldness, acne, darkening of skin, and thinning of hair. Hirsutism is the abnormal presence of hair on a woman's face, neck, legs, and arms. According to Tanya Chambers, presenting symptoms include irregular or lack of periods, extra hair growth on face and back, and darkened skin around neck and thighs. The most common symptom is the loss of menstruation. This condition has a number of associated symptoms: cardiovascular disease, diabetes, endometrial cancer, breast cancer, depression, bipolar disorder, anxiety, and eating disorders. PCOS weighs a lot on a woman's psyche. The condition affects women physically, emotionally, and psychologically. PCOS affects women physically through the physical manifestations. This condition affects women emotionally due to the imbalance in hormones, which can then affect women psychologically. Most women with PCOS suffer from a negative body image and negative self-esteem. According to Tanya Chambers, PCOS patient, I was pretty embarrassed about the dark skin around my neck. This symptom and many other symptoms can weigh heavily on women. Obesity and the growth of body hair can lower a woman's opinion they have on themselves, causing them to become embarrassed, saddened, anxious, and possibly battle with eating disorders. 34% of women with PCOS suffer from depression. PCOS is the most common cause of infertility in women. 40% of PCOS patients suffer from infertility. According to Michelle Munch, certified registered nurse practitioner of the Fertility Center, infertility is the inability to conceive after 1 year of unprotected intercourse in couples who have regular periods and have normal semen analysis. PCOS causes an inability to ovulate and get a normal period. Ovulation is a period of time in which a couple can conceive a child. Without ovulation, it makes it hard to know when the female is fertile in order to conceive. The treatments on the next slide help with ovulation so proper planning can begin. According to Michelle Munch, certified registered nurse practitioner of the Fertility Center, treatment is determined on the goals of the female. Those two goals are either to get pregnant or to maintain the symptoms of the condition. For women who want to become pregnant, there are a number of treatment options that could help. First, a 5% weight loss is strongly recommended. Losing 5% could help start ovulation and a regular menstrual cycle. The second treatment option is the combination of metformin and fertility drugs. The use of metformin would help lower insulin numbers and help the female to lose weight, in which would help the fertility drugs work more effectively. Another way is through in vitro fertilization. Women who do not want to get pregnant are told to lose weight and exercise. These women are put on maintenance drugs such as birth control, metformin, and anti-androgenic medications to manage their symptoms. The most recent research was conducted on genetics, environmental exposure, ethnic and racial symptom differences, medications and supplements to start ovulation, obesity and PCOS, and health risks for children and women with PCOS. There have been a few studies conducted on the relationship between depression and PCOS. However, there have been no studies on the effects of depression medications and other treatments for PCOS. PCOS and depression are correlated. The symptoms of PCOS can cause depression due to negative body image. The relationship between depression and PCOS needs to be reviewed so that physicians know how to treat depression. This data would be able to decide whether the woman needs medication or if a support group would suffice. This data would also help physicians steer new policies for PCOS. I hope you learned a little bit more about PCOS. For more information, please check out the additional references.